Good morning. My name is Davis Nyeriki. I'm a student pharmacist at ISU. Could you verify for me your first and last name and date of birth, please?
Sure, it's John Clark. My date of birth is April 15th, 1953.
That really matches the prescription that we did get from the hospital. The doctor did prescribe a medication by the name warfarin. They call it sometimes Coumadin. You'll hear some other names like Jantoven. It's one tablet by mouth once a day. And I do recommend you taking the medication at 5 p.m. Did the doctor go over this medication with you?
No, he just told me I'm going to take it for my heart, but he didn't mention anything else.
Do you have a minute for me to go over this medication with you?
I do.
Thank you very much. So this medication is normally used to treat heart problems, and I'm assuming he must have said something to do with AFib.
Yeah.
Very well. So basically, the medication is taken at 5 p.m. and the reason because sometimes patients do have appointments coming up in the mornings. Do you have an appointment coming up?
In 3 days.
In 3 days? Very well. And therefore, you taking this medication at 5 p.m. will enable the doctor be able to run what we call an INR and check your blood levels. And this will tell the doctor if they need to make adjustments on the doses that you're getting. Today you're getting a 5 milligram dose, and you're getting from us 30 pills, and you do have 3 refills that you'll be picking from us. I do want to appreciate that you're coming to us to get these refills, and we do want to also make follow-ups of this INR that it entails blood work that you will be doing. Now, what is this warfarin and what is INR? So basically, my INR today is 1. Our goal is to make sure that your INR comes between 2 and 3. And the reason is because when your INR goes up to 10, that really means that your blood is getting thinner and thinner, and the chances of you bleeding is extremely high. But when your blood comes down to at least 1, it means that you're clotting, and therefore that can be a serious issue for you. Therefore, our goal will be to maintain it between 2 and 3, so as at least to keep you safe. There are so many things that come along when we are trying to maintain this INR at 2 and 3. One of the things that I noticed was drug interaction, and on the list that the doctor did send of medications that you're getting, it looks like you're getting a medication by the name ibuprofen. That is a medication that I'm going to be talking with your doctor to see if they can discontinue, and the reason is not because of the interaction, but basically it increases the chances of you bleeding. Common side effects of this medication is bleeding, which is one of the biggest things that I will want to talk to you about. If you see a stool, like your stool has blood in it, your urine has blood in it, like dark urine, nosebleed that are lasting more than 30 minutes, bruises that are not stopping in one area but they're expanding, you need to contact your doctor and get to see if they can make adjustments or stop the medication at once. Adverse side effects of this medication: if you're getting anything that deals with an allergic reaction, tightening of the chest, you really need to stop this medication and consult with your provider immediately. If you miss a dose, you do not need to panic. Just take the medication as soon as you remember, but do not double dose on this medication. That has serious repercussions, and I do not know how much I can emphasize on not double dosing. Do store this medication at room temperature, away from children. If you do have pets, please keep this medication away from pets, because it can really be fatal to the pets too. Other thing that I did want to mention about is food. Vitamin K is something that you will hear us and also other providers going over and over. Our goal is not to stop you from taking vitamin K, but is the consistency of you taking this food. We do want you to at least follow some protocol, like maintaining the same diet if it's possible, of the same concentration of vitamin K. And before you leave today, I'm going to send you home with a list of food that I do believe contain vitamin K, and there's more to that than what I'm going to provide to you. So basically, be careful on what you're consuming. If you happen to consume something that you're not comfortable with, you can always call us and we can always verify and see what it contains. Other key thing that I would like to talk about is lifestyle changes. We do know that alcohol consumption does increase the chance of you bleeding. So if you do consume alcohol, just remember at the back of your mind, it does increase your chances of bleeding. So therefore, we need you to be careful when it comes to this. Exercising, exercising can increase your INR, but with that in mind, if that happens, just talk to us, and then we can see if this is something that is consistently you have decided to make these lifestyle changes. We can always do modifications if need be. One other thing that I'm thinking I'm forgetting is more of when you get your blood work done by a phlebotomist. Do remember to tell the phlebotomist that you need to use a core band and not a tape when they're covering the hole, the puncture on your skin. And this is to increase pressure and prevent you from bleeding. Like I said, Coumadin increases your chances of bleeding. Do you have any questions for me?
I do not know.
The other thing that I wanted also to mention before before you leave is instead of taking ibuprofen for pain, you can also take low dose acetaminophen, or some call it Tylenol. Do not go above 2 grams when you're taking this medication. And some of the drug interactions that I talked to you about is there's so many drugs that do interact with this medication, so we need you to be really careful. If you start a dose, if you're stopping a dose, it doesn't matter if it's over the counter or at the hospital, do let us know. Especially antibiotics, sometimes people have a small course of like 7 days, 10 days, and do not remember to talk to us about it. Do tell us about it, so in case we need to make any modification on your doses to accommodate this, we should be able to do that. Remember, if you have surgery coming up, let us know so we can also make adjustments on your Coumadin dose too. Very well. Do you have any other questions that
No, I do not.
Thank you very much for your time. And remember, when you step out of the pharmacy, if you have any questions that come, or when you're at home, feel free to give us a call, and we'll be really grateful to help you.
Will do. Thank you.
Thank you.